Hello, I'm Jonathan Olarte, and I will be performing a sterile wound dressing change today. To begin, I would enter the patient's room and identify myself. Hello, I'm Jonathan, I'm going to be your nurse today. I would then identify the patient using two patient identifiers, first name, last name, date of birth. I would then confirm that with the patient's wristband. Okay, after that, I would provide privacy for the patient by closing the curtain. I would then explain the procedure to the patient that I was going to do a sterile wound change on his abdominal wound. Okay, I would then put the patient in a comfortable position. In this case, I would elevate his bed to about waist level and place the patient in supine position. I would ask the patient if he is experiencing any pain. If he were to tell me he were in pain, I would do a complete pain assessment. I would ask the patient if he could identify where the pain is, if he could give me a rating from 1 to 10, 10 being the worst, what rating he would give the pain. I would ask him to describe if anything makes it better or worse, and then I would do some kind of intervention at that point. However, for this case, we're going to say the patient has no pain, so then I would move on. I had already explained the situation, the procedure to the patient. I would then expose the patient's wound site. Okay, at which point I would perform hand hygiene and put on a pair of clean gloves. Once I perform hand hygiene and put on a pair of clean gloves, I'm going to begin by removing the patient's dressing. The abdominal dressing has been taped down, so I'm going to hold on to the patient's skin and pull the tape in the opposite direction. And I would do that to the entire surrounding of the dressing. I would then remove the patient's dressing, and I would analyze for any drainage. If there is drainage, I would want to know any color, the amount of drainage that there was, and if there was any odor. Then dispose of this. I would remove the patient's packing, doing the same thing, analyzing the drainage, at which point I would look at the patient's wound itself, noting for any granulating tissue, necrosis, or slough, which there is none at this point. I would then palpate the patients around the wound site for any blotchiness. There is none. So I would then measure the patient's wound using the measuring tape without actually touching the wound. In centimeters, I would measure the length, which is about 13.5 centimeters, and the width, which is about 2.5 centimeters. I would then want to measure the depth of the wound using a sterile cotton-tipped swab. Grab one, then I would place it in the patient's wound, trying to find the deepest site. I would bring my fingers down to where the wound would begin, and then I would just measure that. Again, in centimeters, it should be about 3 centimeters. Making sure to document all of that, disposing of this. At this point, I would remove my dirty gloves, perform hand hygiene, At this point, I want to start setting up my dressing, my dressing change tray. So I would open the dressing change tray, and I would pick up the sterile field, making sure to pick up where it says pick up here on the sterile field. I would open the sterile field, not touching the inside of the sterile field. I can can touch the bottom of the sterile field, however I can't touch the inside, and remembering that I only have a 1-inch border to work with within that 1-inch border. At this point, I want to dump the contents of my tray into the sterile field, ensuring that everything lands within the 1-inch margin. I then want to pour saline into my tray. This saline, as you can see, has already been used. I would want to check for the time and date that this saline was last used. I also want to lip it. Alright, and then I can pour the saline, making sure not to touch any of the edges of the tray. Alright, at this point I'm going to apply hand hygiene once again. And I'm going to want to don my sterile gloves. I'm going to don my sterile gloves using the aseptic technique. I can touch the outside of the gloves. I just can't touch anything on the inside. So I'm going to be pulling the tabs open. Alright, once again I can't touch the inside, but I can touch the outside. I'm going to grab the first glove to don my dominant hand. Again, touching only the inside of the glove, which will be considered contaminated. Put the first glove on. Then using the scoop technique, I'm going to grab the next glove, scoop the glove, touching the outside of the glove with my sterile glove, and then keeping my thumb away, donning my next glove. Alright, now that my hand is sterile and my hand is in here, I can go ahead and adjust as needed. Alright, I'm going to dispose of this by touching only the inside of the paper, keeping my hands in front of me and above my waist at all times to ensure that my gloves are sterile. Now I can start touching the contents that was in my tray. So I'm going to organize everything the way that I need. I'm going to use this gauze, and I'm going to open it and place it into the sterile saline, which I'm going to use to pack the wound. Then I'm going to open my sterile swab kit. There should be 3 sticks in here, each of which I will use independently. I'm going to use 1 swab at the incision site using a twirling motion from the top to bottom. And then I will dispose.
I know, right? I didn't breathe that whole time.
And I'll do one side. Again, using the same twirling motion from top to bottom.
Don't you want to look it over? No, I don't. You don't?
And then the other side. Again, using the same twirling motion from top to bottom. Now that the wound has been cleaned, I can pack it. So I'm going to use one hand to grab the gauze from the saline, and I'm going to drain the excess saline. Now that this hand is wet, it's no longer considered sterile, it's simply clean. So I'm going to use my sterile hand to grab the forceps and open the gauze. This gauze is going to be used to pack the wound of the patient. I'm going to do the same thing to the second cause. Making sure to pack the wound from top to bottom.
Yeah. Did you throw away mine?
I'm going to use my sterile hand to grab the abdominal wound bandage. And I'm going to, well, prior to that, I would grab the gauze, the sterile gauze, that will be placed over the wound site. And at this point, I would grab the bandage, place it over the wound. Now I'm going to grab my tape. I'm going to tape the borders of the bandage from corner to corner.
Oh, you know what a ratchet is? Ratchet. Sean is so happy that he
Probably was 3 eggs, right?
I hope I do one thing for me. Really.
Oh, I hope both of you. We can still get the wound if you guys.
Right? Sean.
Oh, the cat.
Fucking me too.
Right at this point, I would use a piece of tape
Oh, I know.
using my hand, and I would just document the time, the date, and my initials, which would go on the bandage itself.
Sean, you might have touched
I would then
one thing by accident, but I'm not entirely sure.
cover the patient up,
You didn't see it? So maybe you didn't.
Is this yours?
dispose of all my materials, remove my gloves, perform hand hygiene,
Excuse me. Sean got to have a cap.
place the patient in a comfortable position,
Are you serious?
ensure the patient has his call light, and I would complete my change of a sterile wound dressing.